Good day. My name is Ty Edward Few. I'm the Associate Director of the Denver Prevention Training Center, and I use he, him pronouns. I have with me.
Hi, everyone. Thanks for joining. I'm Helen Burnside. I have been here for 17 years at the Prevention Training Center, and it's an honor to be here with you today.
All right, so today we are going to talk about what we do at the Denver Prevention Training Center. We're also going to talk about our summer learning series, and then we'll have some times for question and answer.
Great. Well, starting off, just to introduce who we are, Denver Prevention Training Center is a nationally recognized training, technical assistance, and consulting organization based here in Denver, Colorado. We have over 46 years of experience serving community-based organizations, healthcare organizations, and state and local health departments. We are located on the Denver Health Campus within the Public Health Institute.
So at the Denver Prevention Training Center, we think about our work like a three-legged stool. One leg of that stool is technical assistance, the other is clinical consultation, and one of those legs is training. So let's look at each leg. We deliver innovative and responsive training to build the knowledge and skills of persons, either in person or virtually, for public health organizations and community health organizations and medical professionals as well. So that's the training part of that three-legged stool. The second part is what we call technical assistance. So we help organizations really think about how to do the implementation of what they learn in the training environment. And the final piece of that stool, the third leg, is the clinical consultations. So the faculty of the Denver Prevention Training Center is made up of some astounding clinical faculty led by our medical director, Dr. Sarah Rowan. These medical providers have decades of experience training people on HIV, hepatitis C, and other syndemics. Our faculty, our staff, is made up of trainers, consultants, and people with community and public health experience, decades delivering that innovative training that we spoke about earlier.
I really love that three-legged stool analogy, and we believe this helps provide our organizations we serve and their workforce with a comprehensive approach to building knowledge, skills, and strategies to implement and improve public health, community, and sexual health programs now more than ever.
So let's talk about our mission, our vision, and our values here at the Denver Prevention Training Center. We spend a lot of time thinking about what that means. And so our mission at the Denver Prevention Training Center is to build the capacity of public and community health professionals and their organizations to provide inclusive, responsive, equitable, and affirming health services. So we achieve this mission by providing training, technical assistance, and clinical consultation services that address the structural drivers of health. So that's our mission.
And then our values, we have three values here at the Denver Prevention Training Center: excellence, equity, and relationships. So I'll walk you through each of those. First, starting with excellence, we commit to a culture of excellence based on innovative learning, evidence-based practices, and collective support of wellness. We achieve evidence-based practices by utilizing evidence-based research and current guidelines from organizations like the Centers for Disease Control and Prevention, Health Resources and Services Administration, as well as the Substance Abuse and Mental Health Service Administration. And we also think about wellness and how we support one another and the organizations we partner with so that we can show up and continue to do this work each day. Our next value is equity, and we commit to deliver services that are affirming, equitably, culturally, and linguistically responsive. And we believe we achieve this by attracting and retaining staff who have decades of experience working with the communities we serve. Finally, relationships, which is what keeps me so engaged with the work that we do, is we cultivate trust with the partners so that we can bridge and enhance health systems with the experience of the communities they serve. And examples of those relationships are our close connections with state and local health departments, community-based organizations, and healthcare organizations, and many national organizations that continue to serve these partner organizations as well. Okay, so we've talked about syndemics, which is a theme here with our summer learning series, but what are syndemics? Within our work here, the Denver Prevention Training Center, and through public health work across the country, in the past few years, we've had a lot of attention towards syndemics. The National Institute of Health defines syndemic as an occurrence and interaction of multiple diseases or health conditions. So this is when two or more health conditions impact an individual, and they can lead to complex health challenges and increased vulnerability. And this can look like an individual that might have syphilis and HIV, or it could mean health conditions such as someone who might be unhoused and also experiencing a substance use disorder.
So at the Denver Prevention Training Center, we really think about addressing syndemics. It also really means considering those social and environmental conditions that impact our health. Sometimes we call those the structural drivers of health. Understanding of syndemics for those community health professionals, those public health professionals, can lead to more effective interventions. So we do this through our training, our technical assistance, and our clinical consultations. We do something called a needs assessment. That needs assessment really allows us to understand what is happening in a community, what is happening in an organization, and in our conversations with those health departments, those healthcare organizations, those community-based organizations, we can really help tailor training, our technical assistance, and our clinical consultations to what is happening in those communities. That is why, if you go back to the three-legged stool that we talked about earlier, that is what makes an effective training and consultation unit. That's really what helps people understand syndemics, address syndemics, and also the drivers of health as well. So now we're going to really talk about our programs here at the Denver Prevention Training Center. We're going to go through the programs that undergird what we do every day.
Yes, and you can find each of these programs on our website under programs at denverptc.org. So we're going to start with the Center for Addiction Medicine Academy. We proudly partner with Denver Health's Center for Addiction Medicine and their Training and Technical Assistance Academy, which we say CAM Academy. And we strive at the CAM Academy to increase knowledge and skills of healthcare professionals, and we're talking about everyone from the medical assistants checking patients in all the way up to the prescribing providers, so the whole healthcare team, and community members to provide comprehensive trauma-responsive care for people with substance use disorders. We have standardized courses that we deliver almost every month. You can see those on our course calendar at denverptc.org, and we also are here to provide specialized clinical training on substance use disorder, linkage to care, care coordination, and also offer technical assistance. The past few years since we've launched, we've been focused in Colorado, but we're expanding our services to Region 7 and 8. And if you're interested about those states, they are Montana, Wyoming, North and South Dakota, Utah, Iowa, Kansas, Missouri, and Nebraska. And an example of our work and how we address syndemics is we are holding continuity of care meetings across the state of Colorado after some legislation passed here requiring medication-assisted treatment for people in correctional facilities. And in these continuity of care meetings, we're bringing together community-based organizations, leadership from correctional facilities and health departments to really ensure that once people are released, they have the care coordination and treatment services they need. Our colleague John Mills runs this training program. You can contact him. His contact information is under our staff on our website.
And people have been putting the website into the chat, so it's www.denverptc.org.
Right. Okay, and then we're going to talk about two of our centers under the national network of STI Clinical Prevention Training Centers. First is our Coordination Center. So here at the Denver PTC, we run the Coordination Center, which functions as the administrative body for the national network, in which there are 8 regional clinical prevention training centers across the country. Through the Coordination Center, we assist with communication, marketing, clinical consultation, and evaluation efforts for our network. You can learn more about that network and that website at www.nnptc.org. And an example of work through this center that addresses syndemics is we've recently fast-tracked and expedited clinical consultations around congenital syphilis. We are seeing an increase in congenital syphilis in almost every state in this country, and a lot of these mothers are late to prenatal care. So we're ensuring that our clinical consultants are addressing those consults and really helping the clinical providers on those mom and baby care teams with the information they need to better care for mom and baby when congenital syphilis is involved. Destiny Kelly is our program manager, and you can reach her on our staff page as well. And then finally, as I mentioned, we have the regional training centers, and we have one here at the Denver Prevention Training Center. So we work with health departments and publicly funded sexual health clinics to provide innovative clinical training to providers who are diagnosing, treating, managing sexually transmitted infections. And we partner with 8 states in our region. So we have Colorado, Wyoming, Utah, Texas, Louisiana, Arkansas, Mississippi, and Oklahoma. We also offer clinical consultation, as we just talked about, and technical assistance. And we partner here with our Denver Health Sexual Health Clinic on the Denver Health campus, which is our large STI specialty clinic. And an example of how we think about syndemics, we provide an STI intensive course. So for new staff entering into this incredible field of sexual and reproductive health. And in that 5-day course, we are giving information on many of the infections that's needed. We talk about HIV prevention, and we talk about other structural factors so that those clinicians leave that training thinking wider than the diagnosis they might be making for the person sitting in front of them. We have a new manager over that program, Crystal Latimer, who's joined our team in January, and you can also find her contact information on the website.
Thank you. Helen, I think we also published a paper under the National Network of Prevention Training Centers.
So our congenital syphilis work was featured in the STI Journal. It was published earlier this year, so if you want to learn more about that, you can find it on Google Scholar or the STI Journal as well. Thanks for that.
So you've learned about 2 of the 4 programs. So we talked about our Center for Addiction Medicine Academy, or 3 programs really, our Coordination Center and our Regional Training Center. Now we want to talk about our Disease Investigation Training Center and then our HIV Capacity Building Program. So the Denver Disease Investigating Training Center is really a natural extension of the work that we are doing, really thinking about training and technical assistance and the needs for disease intervention specialists here in the United States of America. DITC is really one of those programs that when we saw it advertised, we said we definitely want it within our training center, and we went out for it. That launched in 2020. Really, when we think about that work, that's giving us the opportunity to help train healthcare professionals to really investigate and do training and manage infectious diseases. When we think about how that work really impacts syndemics, we really think about how it considers the social and environmental factors that we talked about earlier, and then how those factors really impact people's ability to test, treat, and manage diseases. And we do that through culturally responsive ways. What do we mean by culturally responsive? We think about the communities that are impacted. We think about the learners who are coming to the course. We think about those things, and then we really tailor training to meet those needs. The final program that is a part of the Denver Prevention Training Center is our HIV Capacity Building Assistance Program. That program is one of 11 funded nationwide programs to build the capacity of, and we talked about capacity building earlier, we said the term technical assistance, we talked about consultations. It's really all very similar, and we're doing that for health departments, community-based organizations, and their healthcare partners to strengthen their ability to really implement HIV prevention interventions, HIV prevention strategies, and different things like that. We're doing it across the nation, and we are considering not just the social determinants of health. And if you're looking for more information about that, you can go to our website. We have more information about the social determinants of health as well. And we also consider syndemics as well. We are looking at our ability to help respond to HIV, hepatitis C, and tuberculosis in communities across the nation. An example of that is in April, our HIV capacity assistance team met with the California Prevention Training Center, the San Francisco Department of Public Health, and the Albuquerque Area Indian Board, and the National Minority AIDS Coalition, NMAC, and they collaborated on a Whole Person Navigation Institute. The purpose of this institute was really to equip healthcare and community-based organizations to develop and deliver programming that would really impact syndemics as well. Zami Tinashe Hemingway is the program manager. All of those program managers that we talked about, John, Christo, Destiny, Dr. Mariska Osborne-Wells, who's the program manager of the Disease Investigation Training Center, all of their contact details appear on our website, which is, again, www.denverpreventiontrainingcenter.org. So now we really want to talk about who we are providing these services for.
Great, yeah, and as we've mentioned, we work closely with state and local health departments in our region. So we're often conducting assessment calls, brainstorming, thinking through innovative ways to help state health departments think about their STI and HIV treatment and prevention programs, as well as local health departments too. We also partner with national organizations like NACCHO, the National Association for City and County Health Officials, the National Coalition of STI Directors, and the National Association for State and Territorial AIDS Directors, which is NASTED, to make sure that our state and local health departments have the policy and information they need to drive innovative, responsive programs on the ground. And then we also serve a variety of healthcare organizations. We mentioned this a little bit earlier. Some of these are publicly funded STI clinics. We work with federally qualified health centers who are doing some of this work, as well as other healthcare organizations that work closely with our state and local health departments on sexual health. A few of these examples are the Southwest Clinic in Arizona, AltaMed in California, Crossroads in Mississippi. And then community-based organizations. We often are working with community-based organizations who are providing HIV prevention services as well as other care coordination services to address those structural factors of health. A few examples of recent community-based organizations we've worked with are the Colorado Health Network, our colleagues here, Golden Rule Services in California, the HIV Alliance in Oregon, and Bay Area Community Health in California. There's many more people that we have the honor to work with that we haven't named today, but just a few examples of recent work we've been involved in.
So now you know a little bit about who we are, what we do. Let's get to the purpose of why we are gathered here today. We are happy to announce our first ever summer learning series. It's an opportunity for us to really work with healthcare providers, health professionals, community health professionals, people working in sexual health promotion and infectious diseases, to really give in and get them to start wrestling with how to really address syndemics in their community. So the goal is to provide culturally responsive, innovative strategies to really help these communities think about how they can address social determinants of health, syndemics, and the structural drivers of health. Our goal is to deliver information that is high quality and an opportunity for you to go and implement this in the communities that you are working with. So we're going to be doing this throughout the summer. We have 3 dates coming up: July 17th at 12 p.m. Mountain Daylight Time, August 21st, 12 p.m. Mountain Daylight Time, and September 18th, also 12 p.m. Mountain Daylight Time. You can come to these sessions. We're going to be talking about a variety of subjects. We want you to tell your friends. We want you to put this all over your organizations. It's an opportunity for 45 minutes of really targeted, in-depth conversation and opportunities to learn about tools that you can use, skills that you can use to really help change the social and cultural factors driving health in your communities. Again, those dates are July 17th at 12 p.m., August 21st at 12 p.m., and September 18th at 12 p.m. This is an opportunity to really dig into and learn more about syndemics and how to really change what's happening in your community. We are so excited about these series. Each time there will be a different person, so it won't be Helen and I. I know you're happy about that. You'll have an opportunity to meet our staff and also gain access to the tools that we are using to have a positive impact on health around this country. Our work is not just here in Denver, not just in regions 6 and 7 and 8. Our work is national. We are really hoping to change the health of this nation in very positive ways. So that's our summer learning series. So now it's our opportunity to really interact with you. We thank you for listening to us. We want to take a couple of questions, and then we're going to really tell you where you can see us in person this summer. So we have a couple of questions that are coming in.
We have some questions. This is producer Dane here. I'll be the voice coming over your shoulder. So we had one question come in about, for a young healthcare professional who's just starting out, what kind of resource can the PTC be for them?
All right.
Thank you for that question. Yeah, I think for someone just entering the field of STI, HIV prevention, we have a lot of great resources online on our website that you can check out. You can also contact us at info@denverptc.org. There's a range of asynchronous or online courses that we recommend to new folks, mostly provided by the University of Washington's STI and HIV Curriculum Center. They have incredible podcasts and resources which can just ground your knowledge base in this work. And then if you look at our course calendar or go over to nnptc.org, we have a variety of online courses and upcoming regional courses that you're welcome to attend. If there's something more, a topic you're looking at, not everything is on that course calendar, so you can reach us at info@denverptc.org and we can help refer you or hear more specifically about your training needs.
Additionally, each of our programs have developed what we called enduring materials. These are tip sheets, infographics, things that you can take to really learn about a variety of things. So we have things on health literacy. We have things on really how to understand how to take a sexual history. We have some high-level overviews of motivational interviewing as well. All of those things can be found, once again, on our website.
Great. The next question we had was, people are just curious, how would you summarize the impact of Denver PTC? I mean, can you just speak a little bit from your own experience with the PTC and doing this work? I mean, what would you say about just the impact that it has on the people you train, on the healthcare system? Let's talk about that.
Yeah, that's a great question. I think so. We think of training as really working on that individual level knowledge and skills and capacity. And that's a great tool, as the question before addressed, and really having the individual think about their role in serving their communities and then where there's opportunity to expand services or their own knowledge and skills. So we use Kirkpatrick evaluation model, and we often contact people 90 days after they've been with us in a training, and we ask about what change they made in practice. We see that most people are making changes in practice 90 days after they attend one of our trainings, and those can be things like sharing information with a colleague, revising a policy, changing an electronic health record form to be more culturally responsive. So we track those, and we are seeing that 60% of people typically at post-course are intending to make change, and about 40% of people are actually making change. We also collect information about barriers so that we can continue to support organizations. And then when I think about where we probably make the biggest changes, it's the one in that three-legged stool, the leg around technical assistance, because we're working on structural changes. We're thinking about policies, standing orders, we're thinking about workforce engagement and training as a whole. And so many of the clinics and organizations we work with come to us with a specific problem or a service they want to enhance. And so we work with them over what could be 6 months, sometimes 12 months, to really solve that problem. Many of our staff are trained in lean quality improvement too, so we believe that our partner organizations hold all the answers, but we are the ones convening and helping them with tools. And so we've seen a lot of our clinics implementing DoxyPEP, which is a new STI prevention strategy recently. We've seen clinics implementing express visits to better meet patient needs. So some of these new service lines or enhancement to services are some of the work that we have been involved in recently.
When I think about our impact, I also think about the tools that we've developed. So we developed a whole toolkit on rapid start ART, so how to initiate antiviral therapy for people living with HIV. And we developed this toolkit that really takes everyone from the moment of diagnosis all the way through some of the things like linking people to care, what additional training and support someone would need. So we have done that. That's also on our website. So we are an organization, our impact is we just don't show up and do a training and then we wish you well. We are there for that life cycle. We are there for that workforce development. You can think about the number of health departments that have really benefited from our STI intensive course. I also think about the syphilis in the South that we did. Helen, want to talk about that for a second?
Sure. We worked with most of our states in the southern region and partnered with our amazing colleagues at the Southeast Prevention Training Center to bring leadership from state health departments and key clinics who are managing syphilis in the southern part of the U.S. We've seen a huge epidemic of both syphilis and congenital syphilis in that part of the country. So we brought together these organizations for peer learning and sharing, talking about some of the strategies they're utilizing, what's going well, what could be improved. And then each of these organizations created an action plan. So over 6 to 12 months, what strategies they would implement to tackle the epidemic of syphilis in their communities. And we followed up with them at 8 months, and we saw that over 70% of these organizations had made changes in their organization to address syphilis and congenital syphilis. So we continue to partner with those health departments and clinics on their strategies.
I think the other thing that we really want to highlight is that we are at the forefront of thinking about how to really adequately address what's happening in communities in terms of those social and environmental factors. So when we think about what's going on in communities, we are really thinking about how to train providers, community-based organizations, health departments, to think about those conditions that are not always visible. So our impact is not just talking about something that is a medical condition. We also get into the social determinants of health and syndemics as well.
Awesome. We have a couple more questions here. We might be able to wrap up a little early, but we want to go back to the syndemic discussion. And, you know, syndemic might be a newer word for maybe some people listening. And so I'm curious, and the question really is, how is syndemic sort of, is that term getting traction? How do you see that sort of picking up, in your world? And then tell us, from your perspective, a world that addresses syndemics looks like what? Tell us about that.
So I'll take part of that and you can take part of it. So syndemics is a fancy word. It's a word that you can see in a journal, and we don't want people to get focused on that. When we're talking about syndemics, we're talking about 2 or more conditions happening in a community. So we can look at the presence of HIV and Hep C, or the presence of sexually transmitted infections and HIV in communities. And so that's what we're talking about as well. What do you think that world looks like?
I think that the term syndemics and a lot of our thinking of this really came about with the COVID-19 pandemic. We saw similar communities impacted by COVID-19, that are impacted by other conditions in the community. So I think when we think about what this looks like in a community or national scale, it's really being able to address these upstream factors that impact health. I think oftentimes our state and local health departments and the way that our structures are is we're reacting to someone once they have a diagnosis versus thinking more holistically about what the community resources are and what the needs are. We also have different clinics. If you have TB, you go to a tuberculosis clinic. If you have an STI, you go to our sexual health clinic. If you have HIV, you go to our infectious disease clinic. And here at Denver Health, and I think many of the clinics we're working with, we're thinking about a one-stop shop. How can we roll out the red carpet and treat all of the conditions that are on someone's mind and not send them down the hall for that other thing they need addressed? And there's a lot of great examples in Mississippi and DC of clinics who are bringing all of these conditions together into one location. I think what syndemics also looks like on the ground is mobile health services where you can get immunizations, you can get tested for a variety of infections such as STIs and HIV or hepatitis. You can get your vaccine and you can get some of your annual screenings. So it's really thinking about where can we provide all of these services to communities in a way that they want them provided to. That's eliminating barriers of multiple trips to multiple places to address conditions.
It's health. It's health for communities and for people who are often underrepresented, overlooked, and have been historically and currently marginalized.
Great. I think that's all the questions we have. Thanks everybody for submitting those.
All right. Well, we are going to be, as the people say, we're going to be in the streets this summer. So we want to thank you for spending time with us this morning, for listening to our overview of the Denver Prevention Training Center. We want you to go to our website, www.denverptc.org, and register for our summer learning series. We also want you to learn more about our programs. We want you to like, share, and comment on our social media platforms. So we are on Facebook, we are on LinkedIn. We believe in the blue sky, so we're at Blue Sky as well.
I don't even know what blue sky is, but you can catch me up on that. Okay, so this summer we're going to be in Montreal at the end of July at the STI HIV World Congress. We hope to see some of you there. We'll also be at the Circle of Harmony HIV Wellness Conference in August in Albuquerque. And in September, we'll be at the United States Conference for HIV and AIDS in Washington, D.C. Thank you so much for joining us. We hope to see you all again on July 17th, and thank you for the incredible work you do each day as well.
Drink some water and enjoy your day. Thank you.